125 million people continue to be exposed to asbestos in the workplace.
So there's a big cost to humans using asbestos in dollars and lives.
Research that goes into these decisions has to be directed by independent, unconflicted scientists.
It's not something that just affects workers, it affects everyone.
Saving one life is great, but saving many more is what I hope to accomplish.
Making a profit off of people's pain and lives is wrong.
We can't quit, not as long as there are hundreds of thousands of people still to be diagnosed.
Ban the asbestos once and for all.
The next speaker is Dr. Eduardo Algranti, who faces significant headwinds in Brazil. So I am very happy to introduce him.
Hello, it's an honor to be here. I'd like to thank you for the invitation. So the topic of my talk would be strategies for recovering hidden mesothelioma cases and other asbestos-related disease cases in Brazil. I'm talking on behalf of the Asbestos Project team, which is financed by the Public Prosecution Office in Brazil. The principal investigators are my colleague Vilma Santana and myself, and those are the other colleagues involved in the project. So, as you know, Brazil is a big producer of asbestos and also a big consumer. So, in the last decades, I would say that there's about 7 million tons of asbestos in Brazil in different forms, as raw material, as transformed products, as in-place asbestos, or also in discarded products, vision, and so on. So, as you see, there's a huge amount of asbestos in the whole country. In the last years, more than 99% of raw asbestos was going to the asbestos chemical industry. So you can see in this graph that the per capita consumption, which is in the left y-axis, is very closely associated to the number of asbestos cement plants in operation in the country. So, most of this asbestos, as I said, is going to asbestos cement. However, this very high consumption, the disease burden resulting from exposure is still hardly visible in Brazil, and there's a very small number of reported cases. So in fact, if you read this paper, which is in the right, from Odger et al., published 2 years ago, on the estimation of the global burden of mesothelioma, Brazil was one of the excluded countries because they thought of poor quality data. If you see the estimation for the burden of mesothelioma cases, we've got officially about 1/3 what's estimated from this work. Using data from a paper by Roberto Pazetta et al., who studied the burden of asbestos-related cancers in 4 Latin American countries, we've got this graph. You can see the number of reported mesothelioma deaths and also lung cancer deaths. Cancer of the pleural deaths is C38.4 in these 4 Latin American countries. And you can see Brazil, for instance, had much less mesothelioma deaths if compared to Argentina and Mexico. And until the beginning of this century, Brazil had reduced of asbestos about 20 times higher than in Argentina and 5 to 10 times higher than in Mexico. It's possible that in Argentina and Mexico they use more extensive use of antelopes if compared to Brazil in proportion. But even so, these numbers are very odd. We did a study on mesothelioma deaths and forecasts in Brazil, and the standardized mortality ratio, it is this top right graph for the whole country, which is the solid line, is stable. It was about 0.7 per million in 2000, and it rose to 1 per million in 2012. So very, very small numbers, like countries that never use asbestos. But in São Paulo state, for instance, there's about the double of mortality compared to Brazil. So you can see here, São Paulo, there's an upward trend of standardized rates of mesothelioma. In São Paulo harbored about 50% of all the asbestos industries in Brazil in the last decades. And of course, we have more medical resources and more awareness of the disease in São Paulo state. Well, that's a number of reasons, but there's no time to go through it. So in the same study, we looked at 3 municipalities in São Paulo that harbored asbestos-cement industries for decades. And we calculated the mean number of deaths of mesothelioma in this 13 years period. As you can see here, there's much more, those are rate ratios compared to Brazil. There's much more deaths from mesothelioma in these 3 municipalities compared to the whole country. So even with bad numbers and with no diagnosis, we can still demonstrate clusters of the disease in areas that had high consumption of asbestos. So in this project, one of the questions is, how can we find hidden cases of non-reported asbestos-related diseases? So we're trying to get information from critical health information systems, and we have many in Brazil. For instance, the Social Security, dealing with compensation benefits. We've got a mortality information system. There's also the compulsory notification system, which includes cases of pneumoconiosis and occupational cancers. And of course, there's hospital admission system and also a system to report specialized procedures. And cancer registries, either population-based or hospital-based cancer registries. So the problem is that we don't get access to identified records. So it's very difficult to link these information systems. So there's no common identifiers. And of course, the systems were created for different purposes. For instance, the hospital admission system is designed for reimbursement, reimbursement of expenses. So, it's the coding, or the ICD coding is not as good as the mortality system. So we did the first study linking mortality with hospital admissions for mesothelioma and cancer of the pleural death. And in fact, we studied adults 30 years of age and older that were admitted to hospitals and died during this admission. And we had a string of variables to make the linkage. Only 5.7% of these links from these two systems were linked. And then we studied the cases only in the hospital admission system, and much of them were cases of lung cancer and breast cancers. So it seems that, in fact, were false negatives in the coding of the hospital admissions. So we did the same linkage with the hospital cancer registry, and the same findings were replicated. Only 2% of them were cases of true mesothelioma. Most of them were cases of lung cancer, and 8% cases of breast cancer. So there was also a number of pleural metastases, so that was the reason possibly where they were coded as pleural cancers or mesothelioma during hospital admissions. So in fact, we also tried to, we said, okay, mesothelioma is a rare cancer, let's do the same with something that is more known as larynx cancer. And we found a better agreement with larynx cancer compared with mesothelioma. And in conclusion, we think that this analogous data linkage works well, but it's just a question of linking records. So it seems to us that in spite of this good performance, most of the cases coded as mesothelioma were false positives, but more frequent cancers as larynx and possibly as lung cancers, I think that maybe this strategy will work. Okay, and I'm sorry to rush, and I thank you for the audience.